Good morning friends, I'm Dr. Amit and this video is going to talk to you about the A to Z of buccal fat surgery. Buccal fat surgery is a relatively quick surgery for people who know how it is to be done. For example, we do a buccal fat surgery in less than 5 minutes, and in my earlier days it used to take almost about half an hour. Now, what does buccal fat achieve? In what patients you should not be doing buccal fat, and what are the real indications? So anyone who wants to have a more chiseled look on their face is a candidate for buccal fat. But is everyone a candidate? Probably yes, as long as we realize what it can achieve. So let's understand it from here. Now, this is the bone. So this is the bone of the cheeks. This is the bone of the jaw. So you can clearly feel two hard layers here. And if you clench your teeth like that, you can feel a muscle here. Then the lips here. So when you actually outline these four areas, you will find there's only a very small area, probably only about 2 fingers, that is in the middle, and that is the area of the buccal fat. So any surgery on the buccal fat can only affect this area. It can't affect here, here, or here, or here. So many patients sometimes come, they ask that when we do buccal fat, our face will get thin. Yes, it will. It will get more chiseled, but here. So someone who's thin, say for example, not me of course, but someone who's thin, the buccal fat, once we do, it gives a very nice angular look. But someone who's a little more chubby, say someone like me, so I announce that I do Botox on my face to make it a little, so you can see this V kind of a look here, which is not my original self. So I have a very round face in my original self. So I do Botox here to make it more chiseled. Now, if someone is more round, so for example, if I wanted a buccal fat without doing Botox, it will not serve a purpose. In fact, it will look much worse because I'm all golu here, all round here, and this goes in, it will actually appear much more weird. So for a thin person, this is usually enough. For an athletic person, this is usually enough. But someone who's a little more chubby, my first approach is to first handle the face fat. So I do a 𝗿𝘂𝗍 and remove fat in this segment. So I remove fat here, all along the neck, try to chisel out the jawline. Then I do Botox for the jaws. So I do Botox for the masseters, get this in, get the V, and then do buccal fat. The patient may still require a bit of fillers on the jawline to redefine the jawline completely. They may even need threads to pull up the face. It depends. That depends on the aging. But it's important that buccal fat identification before surgery, so indication and what it can achieve, should be very clearly discussed with the patient. And blindly, a person should not go for a buccal fat. So if you're a chubby person looking for a facial recontour, consider that you will need more than one procedure. Now, buccal fat is permanent. Face liposuction is permanent. Always do face liposuction with 𝗿𝘂𝗍, never conventional. It is just not safe. And finally, you may actually need a bit of cheek filler to just lift this up a little bit, gives a more V appearance, and then Botox for the jaws, which lasts about 6 months or so. So these are the things that you will need in order. Now, buccal fat surgery can be done under local anesthesia or general anesthesia. Local anesthesia takes about 10 to 15 minutes. General anesthesia actually takes less than 2 to 2.5 minutes. I do it by a half a centimeter cut inside the mouth, and I don't put any stitch. It does not need any stitch. By next day morning, it is all healed up. Prevent hot liquids, hot foods, exercise for some time. Hot foods for about 2 days, exercise for about 5 to 6 days. You may get a little bit of swelling here, but that goes away in 2 to 3 days. There's not much pain. If properly done, there's no nerve injury or any other injury, and it is actually a very safe procedure. So if you're looking for something in terms of a buccal fat, a facial recontouring, do get in touch with us. You can WhatsApp us. You can even video call us. We can assess your face. Once we make an assessment of your face, we'll tell you the exact plan that you need. And such a procedure, if you're traveling from outside India, you can be here for just 3 or 4 days, and that is usually enough. In the pre-operative phase, we need some blood tests, medical history, so that we know there's no medical problems with you. And that's really all that is essential. So this is a very safe procedure. If I was to summarize, it's very quick, very safe, might need additional procedures, very short post-operative instructions, and it's actually a very satisfactory procedure. The final result can take about 6 weeks to show up, because that's the time it requires for the skin and the mucosa to join together. So cheers, have a great day, and you can message us on our clinic numbers. You can drop us an email as well.
Know more from Dr. Amit. Call us on 9811994417 or just Google Divine Cosmetic Surgery.